Hello and welcome to Connect. I'm your host, Randy Shabilo. On today's show, we'll have the CEO for Lung Saskatchewan, Erin Kuan, talking about the 115th anniversary of the organization. And as always, we'd like to connect with you. Email us at rtvsaskatoon@rci.rogers.com. Find us on Facebook at ConnectYXE and catch past interviews on our YouTube channel. Lung Saskatchewan is celebrating a major anniversary. We have the CEO, Erin Kuan, with us. Thanks for coming to the studio.
Thank you so much for having me.
I want to talk a little bit about Lung Saskatchewan. It's had a name or two, but it's been around for a long time. Let's maybe start there.
Right. So actually this month we're celebrating 115 years really in the business of lung health and looking after lung health in Saskatchewan. Lots of people might actually know Lung Saskatchewan by kind of what I refer to as our great-grandparent organization, which was the Saskatchewan Anti-Tuberculosis League. And that was the organization that was started in 1911 really to address the tuberculosis epidemic. And so really kind of through hundreds of volunteers and staff, built the sanatoria in the province, and then we're really responsible for delivering tuberculosis care for many, many years.
I don't think I knew that. I'm thrilled to hear that. I remember the sanatorium in Saskatoon on Avenue K, a beautiful spot. And you yourself, how would you come to get involved? Is that something that you looked at when you got out of school and said, I think I'd like to try that?
You know, I back when I was going to school many, many years ago, you didn't actually, there weren't really many opportunities to go to school to learn how to work in the nonprofit or the charitable sector. And I like to say that at that time you really fell into fundraising or you fell into working at a nonprofit. And so I was very fortunate to start working with the YWCA of Saskatoon, with the shelter and the wellness programs there, and then moved on to actually 20 years with the MS Society of Canada and working with people from across the country, and of course learning so much about how a disease or different circumstances can really look so different for many people. And then my career just in the last 6 years or so took me to Lung Saskatchewan and the opportunity to lead a great organization that had great leadership long before I arrived. But it's because of some of the work, much of the work that was done by really thousands of volunteers over the last 100 years that we've been able to evolve and now do the work that we do in Saskatchewan.
So with tuberculosis, it's not as prevalent, you know, comparatively speaking, to when it started. So
yeah, it's complicated. So when our organization actually got out of delivering direct tuberculosis care was back in the 80s, and that's when kind of the last of the sanatoria shut down in Fort Qu'Appelle. And our organization really moved into what we do now in the areas of education, advocacy, research investment, those kinds of things. But tuberculosis wasn't necessarily eradicated, and I think that's what a lot of people do believe. But it still does exist in many of our northern communities in the province and in many countries globally. And so it still actually is a huge issue across the world, and something that now there are organizations, TB Canada being one of them, but hundreds of researchers and healthcare providers that are really in that field directly. So the work continues, certainly not to the degree, we don't see the epidemic the way that we saw COVID or that we saw tuberculosis 100 years ago, but it still certainly does exist.
So I think one of the misnomers I would have, personally speaking, that you think Lung Saskatchewan, lung cancer, but there's so many more different types of ailments that can affect the lungs.
Absolutely, absolutely. So it's, we always talk about in our organization, sometimes it's difficult to articulate the variety of spaces and places that we work in because we do serve people with lung cancer, with COPD, with asthma, with variations of cystic fibrosis, all those kinds of things. So really anything that can affect the lungs, we probably have a stake in there somewhere. I think one of the things that communities that we're really serving that's quite prevalent right now is also people being diagnosed with sleep apnea. So we often say sometimes it's more than a snore. So if you have someone that is snores really loudly, all those kinds of things, doesn't always mean that there's sleep apnea, but that blockage in the throat is actually restricting oxygen that's flowing to the lungs, and so it actually is a diagnosed lung condition. And so even sleep apnea is a space that we do a lot of work in.
I had no idea about that.
Yep.
If people are experiencing something like that, they wouldn't phone you. It would be a medical doctor that would do something. You're in the background helping that profession.
Yeah, so it's actually a combination of things. We actually are really fortunate at Lung Saskatchewan. We have 2 registered nurses on staff, and they actually support our helpline. So people can call the helpline and they might say, my wife keeps telling me I snore really loud. She says I should get it checked. What should I do? Then one of our nurses can say, okay, this is the conversation that you should have with your GP, and then they will refer you to a sleep specialist and a respirologist for you to get tested. That's really the only way to have that confirmation is to get properly tested and diagnosed, and then you can get set up on the right therapies that would work for you. But and sometimes someone will have talked to their GP and say, I have more questions. I need to know more what this looks like. How will I navigate the insurance system for this? How can I pay for this, or what other supports might be available? And we're often able to help with that.
Do you guide employers, for example, if I'm thinking grain dust or working in a mine or in enclosed environments, welding, something like that? Would you work with employers to kind of give guidelines and here's a threshold for your staff or help people like that?
So I think specific thresholds and things like that would be more, that information would be better sourced through lung specialists like respirologists and things like that. But we have actually been able to connect employers with ensuring that they're adhering to spirometry testing, which is really lung function testing. While we don't do that delivery ourselves, we can connect them with the right folks that might do that. So for example, if you work in a mine, you have to have regular lung function testing, and that's something that the company has to adhere to. And so we will, during COVID, for example, we had, there was a few larger companies that we were able to say, well, we don't do this delivery, but we can connect you with these people, or this is what you need to look for. And so in that way, we can help, again, just really navigate the system or kind of connect the dots for people.
What are you seeing with, or is there an increase in something like vaping? We've seen smoking kind of curtail. Both of my parents smoked. I tried it, couldn't handle it. Are you seeing numbers, or do you get data that kind of shows?
Absolutely, yeah. So, I mean, the good news on one side is that we are seeing nationally smoking rates are going down. However, the rates at which vaping are increasing are certainly outpacing that. So we are right now, I believe, in a much worse situation with the number of people that are vaping than are smoking. And vaping is tricky because a lot of people don't realize that it is the number of chemicals that you are inhaling when you're using a vapor product. The product that is in vapes is often called vape juice, and that's intended so that you think that it's not a harmful product. But the vape juice is really just a combination of oils and chemicals and all sorts of really terrible things. At the end of the day, our lungs are really only meant to inhale one thing, and that's clean, fresh air. And I think the concern with vaping is the impact on young people. And young, healthy lungs are being subjected to this. And the other piece too, Randy, is that the concentration of nicotine and chemicals in a vape pod is far more concentrated than what you actually have in a cigarette. So often having one vape can be the equivalent to smoking 1 or even 2 packs of cigarettes. That's
one vape?
Yeah, which is very scary.
So are you seeing a correlation with youth kind of transitioning as they mature? Youth, I'm thinking teenagers, perhaps?
Absolutely, yeah. So we do, Lung Saskatchewan was actually successful in advocating to the provincial government to raise the age of being able to purchase vape products from 18 to 19. So we're asking that it was on par with the age to purchase cannabis and tobacco.
Yep.
So that was great. We were really pleased with that change just over a year ago. But there's a lot of work to be done on regulation and access to kids. There's online sales that just by typing in a number, you can say that you're 19 and you can still get products mailed to you, and just the black market system as a whole is still it's the Wild West.
What would you, just personally speaking, 5 kids, a couple of grandchildren, what would you advise someone in our roles to try and help monitor and engage our kids to stay away from that?
For sure. I think, the biggest thing as a parent myself is it's not about judgment, it's about a conversation and education. I think as, I'm shocked and I'm, I pay attention to these things purposefully, obviously because of the work that we do, but I'm shocked at the innovation in the vape products and what they look like. Pens, USB sticks, zipper pulls, they're so easy to hide. And so I think it's the conversation with your kids to say, have you seen these? Has anyone offered you them? What did you think? What did it taste like? Do you know about them? Really just educating them on the conversation. There's actually quite a bit of social media outside of even what we do that is now starting to talk about it. As we've had some celebrities more recently that have come forward with stories of vaping. They've either had a mild heart attack or they've been diagnosed with sometimes what we call popcorn lung. So the conversation is becoming more prevalent.
Are you seeing any side effects trailing off with COVID as an example? Is there something that you can share about that?
Yeah, so COVID, of course, was such a complicated time for so many people. I think what COVID brought to light was just the importance of our breath and how we can often take our breath for granted, and just also about taking care of ourselves. For example, just things like when you're not well, not going to the office. So many people now have the option of staying home to get well or staying home to work, whatever you choose. But I think we've learned to be more forgiving of ourselves when we're not well, and also forgiving of others, but also politely saying, you're not well, I need to protect someone in my family that lives with a lung condition, I'm okay, and that's okay, right? So those are, some of the lessons learned, and I think just better hygiene in overall.
Would you say, in terms of the funding for Lung Saskatchewan, is that through fundraising or donations, or how does that happen for
all
you?
of the above? So we run a couple of raffles every year. So similar to like lotteries or lots of our raffles. We have one that's will be starting sometime in March, and a great prize-based raffle. There's trips to see the polar bears. There's trips to a Jays game. Create your own vacay. We've got Air Canada trips for anywhere Air Canada flies with an Airbnb voucher, some really fun things, as well as we end up with a great big 50-50, which we love in Saskatchewan. We love our 50-50s. So we run 3 of those a year, and that certainly is a cornerstone of our fundraising. But we also rely on gracious donations from people all across the province every year through direct mail, through online donations, through events, things like that as well too. So it fuels the work that we do across the province, just like it started 100 years ago, and we're just so grateful to still be able to do the work that we do.
What can you share in terms of some of the things that you are involved with as an association with radon as prevalent in our province?
Yeah.
What types of involvement do you have with that?
For sure. So with radon, our role is really one of education and awareness. So we want people to really become informed of the dangers of radon. And sometimes people say, well, I have a carbon monoxide detector in my home.
Sure.
Of course, really, really important. You have a smoke detector. Equally important. What we would love to see is people test their homes for radon. A lot of people don't know that radon is actually the second leading cause of lung cancer next to smoking. And radon, you can't see it, you can't smell it, you can't taste it, but it's there. Every home has some level of radon, and the only way to know is to test. We encourage people to get a long-term test kit, so usually a 90-day test kit, a Health Canada approved one. You can get some kits in big box stores, which aren't terrible, but I think the best way to really measure is on a long-term Health Canada approved test kit. And from that, you can make a choice. You can say, okay, my levels are within that threshold of the Health Canada recommendation of 200 becquerels, which is the measurement indicator, 200 becquerels per cubic meter, or it's above that, I want to talk about getting my home mitigated. And that's when we have a list of certified mitigators in the province that can do that work for you. And it's as easy as, when you have to get your air conditioner tuned up or replaced, or a furnace or a water heater, all those things that they are expenses, but they are household expenses that keep our homes healthy. And so that's what we really want people to think about.
It's all very fascinating, and I had no idea the depth of Lung Saskatchewan and the work that you do. If someone wanted to get a hold of you or the association, what's the best way to do that?
The best way is probably to go to lungsask.ca. And on our website, not only is all of our contact information on there, but there's also just a plethora of resources, everything from how do I get my child to use an inhaler with an aero chamber to I'm a respiratory therapist, what education sessions might I be able to take, to how to support the organization. So lungsask.ca.
Perfect. Erin, thank you so much. Happy anniversary, and best of luck in your future here.
Thanks so much, Randy.
That's our show for today. I'd like to thank our guest, the CEO for Lung Saskatchewan, Erin Kuan, for coming on. I'm your host, Randy Shabila. We'll see you next time on Connect.